All right, we are live. This is Dr. Michael K. with the Center for Functional Health, and today I have the honor of interviewing Dr. Christian. Dr. Christian, thank you so much for taking time out of your busy schedule and speaking with us today. We've had several conversations prior to this. I'm always learning something when we talk, which is absolutely wonderful. And today my goal is to really cut through what patients and consumers hear on the internet regarding peptides, regarding cellular regeneration, regarding detox, and really just give them a pathway so they understand what they need to do and how to do it properly and what to look out for. So thank you very much for your time. Really appreciate it.
Thank you so much, Michael, for having me. I'm excited to be here, and thanks for the work you do as well. We've been collaborating on some patients, so it's an honor to be here and love to educate. So let's really get into it and make sure people can have the knowledge they need to support their health.
Super. So let's give them a little bit of background. Trained at Harvard, trained at Johns Hopkins, and you're in a traditional model, but somewhere along the way, like, hey, this is fine, but there's got to be something better. So
yeah,
so a little bit of your background on that.
Yeah, so thank you for that question. So yes, I was very fortunate to have the experience of attending those institutions, and what I got from there was very important way of looking at health and disease, having a critical mind in terms of looking at information, how that information translates for people, and then also understanding the limitation of that type of information, because we do studies and we have a specific population that we study. And then the people that are going to be in front of you as a physician, as a clinician, as you're taking care of those people, are not going to be the people who were studied. So they have differences in their physiology or in their biology that you have to go beyond having other means to, do the right thing for the person in front of you. And then it comes back to really fundamentally optimizing the pillars that we always talk about: the sleep, stress, nutrition, exercise, making sure that we're doing those very well.
Excellent. Excellent. So on your website, you talk about lifestyle medicine, you talk about cellular medicine, you talk about integrative medicine. So and I know like all these link together, but when you're looking at a patient, are you putting them in like, okay, they're in this bucket, they're in this bucket, they're in this bucket? Or do you feel like, hey, we have to do something first, physiologically change something so on a cellular level, they can meet the demands as you begin to heal them?
Yeah, so that's a great question. And all of those things are actually complementary. It's just, the cellular medicine is an approach and it's a lens to look at, disease. I'm a pain specialist by background, but now I focus on health optimization. So I have to understand a little bit about every system in the body. And when we look at, through the cellular lens, this is actually things that we learn in medical school and in our training. And every cell in your body, before a disease shows up, a cell become dysfunctional. It's not working as well. Maybe it's not making energy efficiently. Maybe it's not repairing itself efficiently. Maybe it doesn't have the nutrients or the signals to do the work it needs to do. So whatever the disease is, we want to try to figure out what is the cellular dysfunction, the pathology, the thing that has gone wrong, and how do we kind of restore those things. And then when it comes to like integrative medicine is really combining the cellular understanding and having the conventional medicine, and then also looking at the foundational health lifestyle things, which actually has a lot of great evidence. So when we're talking about these things of sleep, nutrition, exercise, stress management, those actually have very strong evidence in terms of restoring cellular function, in terms of restoring health, and people can validate these things for themselves. So all of those things are things that are integrated. There is place for us to use pharmacotherapy where somebody may need a statin, but that's not enough. We have to fix their gut. We have to talk about hormones. We have to talk about other ways to mitigate the potential risk of a statin. Do they need to be on a CoQ10? What else do they need to do? Lifestyle, all of those things. So it's just a lens of how we look at solving health. And I always talk about the idea of, there's a difference between solving health and solving sickness. And if you want to solve health, you can't only rely on conventional medicine, because that's designed mostly to kind of address some of those disease states when they've already happened.
Right. So, I mean, and that's the one thing where patients/consumers often get themselves so overwhelmed because they hear so many different things. Take a statin, don't take a statin. Yeah. Consider peptides, don't take peptides. GLP-1s are great for you. GLP-1s can cause, thyroid cancer, right? So it's got to be very difficult. I know when I see patients, it's like we're spending a good deal of time of talking about what they've learned, what ChatGPT says,
Yes.
and then we kind of need to frame it in a way of their own physiology. So when a patient comes to your office, it's not just like, oh, my shoulder hurts. That would be too straightforward for us, right? It's this list of symptoms. So can you share, when a patient comes to your office, what do they go through first? I mean, what kind of intake do you have, and how, in your position, do you like, okay, you know what, here's the medicine, here's why we're going to take the medicine, but here's what we're going to do on this side to really optimize your health?
Yeah, so that's a great question, because that whole conflicting information that patients get at the end of the day is a patient who suffers. And I know all of this, all of us in health, we all have good intentions. But sometimes, depending on where people are in terms of their level of education or what they do and what incentives they have to learn certain things, the knowledge may not be there to support patients. So what we want to talk about simply is, yes, there's a place for medicines, there's a place for peptides, there's a place for GLP-1s. All of those things can improve health. What is fundamental that I want patients to understand is that it's not just going to be one drug or one peptide or a hormone that's going to solve all your problems, okay? All of those things work well, and you get better outcomes or have less side effect when you are healthy. How do you get to health? Sleep, stress management, nutrition, exercise, the fundamental things. And then even when it comes to that, there's also nuances. So how do we dose sleep for you? How do we dose exercise? How do we dose nutrition? We know all these things are great. So there's ways to kind of look at all of those things, and it becomes personalized. And I think this is where sometimes patients will have conflicting information in the space of, well, the literature or the study showed this, but it's not working for this person in front of me. So we need to personalize all of those ideas, and then we can bring on all these peptides and everything else, because everything works in the right person. Nothing works in the wrong person. So that's the idea that we want people to understand. And then when it comes specifically to my practice and what I do for people, when people come in, just like you do, we spend the time, and I spend more time. We spend an hour or whatever it needs to really understand their goals, their problems, what's going on. And my background is in pain. And so people come to me and I have a shoulder pain, right? Like you just talked about, but they're not sleeping. They have some gut issues. They have some skin rashes. They're gaining weight that they don't want to gain. All of these things are going on. So if I just focus on the shoulder, I'm actually doing a disservice to these individuals. So what I try to even explain to patients and to the larger community of my approach is to think of it this way. And then this will make sense to you, Michael, because I say, there's two types of car mechanics. There's one mechanic that you go to see, your light bulb is out on your car, who is just going to replace the light bulb and send you on your way. There's a second mechanic who's going to ask the question, why is the light bulb out? Is it your wires? Is it your battery? More importantly, this is a car. Is your transmission working? Are your brakes working? Are your engine working? Your transmission, your brakes, your engine, those are actually the things that when they go wrong will put you at risk instead of the light bulb, okay? And that's what we do in conventional medicine. People shows up in doctor's office with complaint and we just cover it up. We don't ask why. Because if you come to me and you have a shoulder pain, yes, that's easy for us to fix. But if you have metabolic dysregulation, if your insulin is too high, if your lipids is out of whack, those are actually the things that are actually going to put you at risk. So we listen to patients, and then we take them through this thing called the health span assessment, where we look at all the markers that influence overall health, inflammatory status, nutritional status, lifestyle. We get all of that information. And then once we have that back, then we can look at where do we start. And it's all fundamental. Sometimes people just have to change a little bit of habits. Maybe they're drinking before they go to bed, and then they say, I don't sleep well, I don't recover well. Backing away from the alcohol will help. And then everything become individualized, but it all kind of have to have the foundation of, let's make sure you're eating well, let's make sure you're sleeping well, and then we kind of move from there.
Which is fantastic. And, but those are also like not the sexy things to talk about, in the sense of like getting better sleep, aligning your body with their circadian rhythm. I mean, I often recommend like getting the sunrise alarm clock, right? Not waking up in that fight flight kind of scenario. Doing qigong before bedtime. If you have kids, there's a bedtime routine. Why aren't you doing a bedtime routine, right? There's nothing special about it. No special supplement or anything like that. That's the hardest thing to get the patient to do some of the time.
Yeah. And those are the things that actually makes the most difference. It's not the medications. And of course, yeah, we can, I can give you a medication to help with your shoulder pain. But the very point that you're also making is, then I explain to people, I'm a pain doc. What I'm giving you is actually blocking pain signal. I'm not addressing the underlying issues that's creating that inflammation or creating that disease. So that's where we have to work on with all of these other modalities that are safe, bringing in supplement, peptide, lifestyle, so then we can get to the root cause and solve the problem. Yeah.
Which is a great segue into our next topic. Love the topic of peptides, right? So let's roll it back to let's share, what a peptide is, who are peptides not for? The fact that peptides, everybody's obviously jumping on GLP-1s now, like, oh, it's brand new, but peptides have been around for a while. So if we can talk about, just nice, easy for somebody watching, like, what is a peptide? And then who is it not for? Let's start with that, and then we'll get into who is it for and how it can help with these different types of ailments.
Yes, great question. So peptides, in a simplistic version of things, are basically amino acids that your body put together, and they have a specific function. It signals a cell, or it talks to a cell to make a specific function, okay? And stepping back a little bit in terms of how we use peptides, when it comes to pharmaceutical drugs that we use to solve health or solve disease, we have a class of medications called small molecules. So small molecules are drugs or pharmaceutical drugs that we don't make in our body that we can create for you. An example, aspirin is a small molecule. Metformin is a small molecule. There's all these other medicines that our body doesn't make. We create them, and they focus on a specific pathway in the cell to either help with the disease or help with health. And then there's a second class of pharmaceutical drugs called peptides. So again, these are also things that we make from a pharmaceutical standpoint. The difference is that peptides are a class of medications that your body actually makes the same type of medication to help itself. So you talk about GLP-1 being a peptide. So GLP-1 is actually a peptide you make in your stomach, 𝗿𝗲𝗍𝗃, 𝗿𝗂𝗍𝗶, whatever you want to call it. You actually make that yourself in your stomach when you eat. But the issue is that when you make it, it lasts for 2 minutes and it's gone. So what we do is we can take that same amino acid sequence and attach some other things to it so it stays there a little bit longer. And then there's multiple peptides that we have to help with muscle, metabolism, energy production. So there's all of these things. So that's the difference. So peptides are things that your body makes, and they tend to be less of a side effect compared to small molecules, because it's actually something that your body makes, okay? And then another example that people can think of is even insulin. Insulin is a peptide. So peptides are not a new concept. We've known about insulin since the 1920s. So insulin is something that your body put together to tell your cell to take in glucose. When you have diabetes or you have some issue, we can give you insulin, and it tells the cell to do the same function. So a cellular signaling is a way to kind of look at it from that simplistic standpoint. Who is not a candidate for peptides? It depends on the peptides, but in general, to be really safe, anybody who is dealing with active cancer or have a cancer going on, that's not a person that we want to put a peptide in specifically. If it's a growth hormone or any peptide that leads to potentially increasing how the body is making blood to an area, so angiogenesis, which is a way to blood vessels. We don't want blood vessels feeding tumors and all of those things. And those are all things that we have to kind of individualize for people to understand. In fact, there is also peptides that we use to treat cancer. So Lupron, which is a medicine that we use for prostate cancer and other things, it's also a peptide. So those nuances have to be teased out. But if somebody have an active cancer, somebody's potentially have a cancer, this is something that we want to back away from, and then make it an individualized approach as to who they need to benefit from. So this is something that I would highly recommend, that before you get into this, you want to see a clinician who understands this and understand your history to really make sure they're doing the right thing for you.
So I shouldn't get my peptides online.
Please
right?
do not get your peptides offline, okay?
That's the thing. So we do have some patients, though, that are getting these peptides, and I don't know where they're getting them from, right? So when I refer to you, I'm getting medical oversight. I give them somebody that's digging deeper and finding out which ones they need. So can you talk a little bit about, and I always say, even with supplements, there's so much counterfeit and junk out there, but it can be harmful.
Yes. This is very important, and I hope that people that are listening would take this very seriously. Even when it comes to supplements, the idea is that these things are natural, they are safe, they're easy. Why not take it? Somebody talks about it on a podcast or whatever. So what we want people to understand is, if something is safe for me, it does not mean that it's safe for you. Okay? And then the fact that something is natural does not always make it safe. So these are things that we need to understand. We're trying to individualize. So it's always important to have guidelines with those type of things. When it comes to peptides specifically, peptides are things that are we talk about being amino acids. So there's specific sequence that they put together. They have to be stable. They have to maybe get in the body, do what it needs to do, and then the body can take it from there. If you get in peptides online, and in fact, a lot of the peptides online will actually say that it's not designed for human use.
Right.
Okay, because that's the only way that they can get around to sell these things online. Because to get a peptide, you need a clinician who can prescribe this and make sure that it's done correctly and is safe for you. So I will really recommend against that. And I've seen multiple cases of people doing stuff online themselves, running into problems, and then coming here and we're trying to kind of solve it. Other issues have happened where people are questioning, did I create a cancer by doing all this peptides that I did? And so these are not to scare people. These are actually things that I've seen. And so it becomes really, really important to go to somebody who understands it. And it's always not just peptide. Sometimes you don't even need the peptide. Sometimes you just have to fix your sleep. Sometimes you just have to learn how to breathe and learn forgiveness, learn some of those things. So I think it's important for people to, we all have to step outside. We all have expertise, right? I can read stuff online about how to put electricity together, but I'm not an electrician. There's nuances and things that I have to, respect the person who have that expertise. And we are here because we've spent years going through training, seeing people in front of us, and doing all of these things that gives us extra wisdom. So even the thing that we talk about that's actually very safe and is good for everybody, it's not good for everyone. So this is where I think it becomes really important for people to understand. You need to have guidance. And it's also about the fundamentals, and the fundamentals never change. Those pathway, the benefit of sleep, the benefit of eating well, the benefit of, stress management. All of those things are actually more beneficial than some of the things that we're talking about. So that's the big point. And I will highly recommend against going online and doing these things, because you have no idea where it's coming from. You have no idea what's in there. And if something happens, it already says on the bottle that this is not for human use. You can't go back and sue anybody or have anybody look at it for you. So highly recommend against that.
Yeah, I mean, I would say to patients, like, if you're getting chemotherapy, you wouldn't get your chemotherapy drugs, online, right? So why it doesn't make any sense, right? You're not going to look for the cheapest. You'd have no idea what you're getting. Okay, so before we move on to the type peptides, what about, and you and I briefly discussed this before, and again, thanks for giving me the platform to have the question and answers. Like, what about cross-linkage? We talked about that.
Yes, because the very thing is that, peptides are amino acid sequence. So for example, BPC, I don't know what it is, maybe it's 25 amino acids. So if it's 25 amino acids and you don't get it from a compounding pharmacy or a place where they can actually make that amino acid 25 stay the same 25 until you get into your body, you never know. So if you have something that's not stable, you can have maybe a fragment of 10 of the amino acid breaking off, a fragment of 5 breaking off, or a 12 plus, 8 to make that 25. And if a fragment breaks off, it's a 10 and it's a 5. We have no idea what's doing in the body. Mm. This is where things can happen. So it really becomes important to look at the stability of these compounds. How long, how stable is it? And then also, even when it comes to dosing, sometimes through the online processes, things are not dosed well. There's been cases of contaminates, cases of people actually dying from peptide IV infusions that I know from even clinicians who were have some experience. So that cross-linkage stability of a peptide is super, super important, because we don't know what's doing in the body and you don't want to take that chance.
Yeah, thank you. So let's jump into the first peptide everybody now knows, right? GLP-1s, right? So again, GLP-1s actually in the body, right? We know that. And I've seen where a certain supplement, berberine, they're saying, oh, your natural GLP-1. I'm like, I'm going to question that one. But not that I don't think berberine cannot not help. I think berberine is a good supplement, but to say that's your natural nature's GLP-1, that's a little bit of a jump for me. clinically. If that's wrong, please say so. Jump in on that.
No, you're right, because I mean the simplest way for people to understand like what a supplement does and what a peptide does and what a drug does is this. Okay, so I would say when we are using peptides, a lot of times we're doing it as an injection. We're bypassing the GI tract. If I give you a supplement, even if the supplement works, first your body have to break it down, your gut have to absorb it, and then it has to get to where it needs to get to for it to do its action. Okay, so there's a lot of limitations. If you don't have a good gut, it's not going to get there. If we don't have the right active compound in the supplement, it doesn't do the work that they do. So sometimes people say supplements don't work. They do work. It has to be the right. But if you have a bad gut, that's not going to work for you. The difference is like when we use a peptide, it's more directly talking to the cell. We bypass the GI tract. We take away all of those things, and then it's directly go to the cell and does its function, signal the cell, and it's gone. Okay. And most times it doesn't have to be metabolized by your liver or by your kidney because it's just an amino acid, and it basically it's an end. It just get broken down. So that's why sometimes we have to not take it through mouth, because your saliva and your digestive enzymes will actually break that up and not make it effective. Okay. So definitely there is a difference in efficacy. Berberine is not the same as GLP-1s. And then when we're talking about GLP-1s specifically, I think people think of this drug or this peptide as something that is just for weight loss, because that's what people care about.
Right.
But it does so many things. It controls inflammation. It controls immune activity. It makes your body more efficient at making energy. It's good for controlling insulin. There's all this other benefit. And I think what people are missing is just focusing on one effect of the drug. I just want to lose weight. Okay. But there's so many things. So even for me as a pain doc, I use a lot of GLP-1s, not for weight loss, but actually to control pain and immune activity. So I have patients that have autoimmune problems, and I may have to put a little peptide because maybe they can't tolerate biologics. The conventional medicine that we have is not working for them, or maybe have a higher risk that they don't want to take. Then the approach becomes, let's explore these low doses of GLP-1s plus this to put it together. So there's nuances, there's differences, but think of it as supplement is like, you're using a translator. Somebody have to translate it for you. Whereas, a peptide is something that is like, you speak my language. I'm talking to you and right away you can understand everything. Whereas when I'm doing that interpretation between you and the message, there might be some loss of information. They're different things and they all have a place, and we just have to educate people about how these things work.
That's beautiful. So, I mean, so the peptides are signaling molecules is what they are.
Signaling molecules. That's exactly the right word. They're signaling molecules. They talk to the cell, tell the cell to do. And in fact, that's what your body does. Your body communicates. It makes these peptides and it talks to the cell, tell the cell, do this, do that, and then it's gone. Okay. Right. And that's what we want the body to do. We don't also want to and the great thing about peptides, as we know, is, and especially GP1, you don't have to take these things forever. Sometimes people kind of feel like I have to be on these things for a long time. No, we're trying to kind of repair, restore, communicate. And then after that, if the problem is not there and the foundational things have been optimized, people actually can back away from them instead of a drug that you have to take all the time.
Yeah, I always feel like these, again, marketed weight loss, but I always say it's a brain drug is what it is, right? So, I mean, and the byproduct is weight loss, but the byproduct that we're seeing is like, I mean, aside from the control of, insulin, the hemoglobin A1C improves.
Yes.
Inflammation in the joints also improves.
Lipids.
Those who have almost addiction, like to whether it's gambling or carbohydrates, right? It just seems down. And we have also seen those, since it dampens everything kind of dampens as well. So we have seen, maybe you can speak to a little bit, changes in personality as well. Some of their oomph has gone away. And in our office, like, okay, you're on the GLP-1, that's great, but we really got to focus on protein. We got to focus on fiber. I'm worried about nutrient deficiency. We worried about, how you're going to actually optimize this improvement and not lose out on the other side. So we see, again, I think it's wonderful. And we're seeing some, not only physiological change, yes, we lost weight, but we're seeing changes that are showing up on labs, which is great. But also we got to balance this somehow.
Absolutely. And the piece that you're talking about is really important, because the thing that GLP-1s does is they have all this pleiotropic, or they have multiple impact. And one of them is they work on the hippocampus of the brain. So they actually changes habit. And one of the things that I've actually become very interested in since I got into this longevity integrative space is really habit change, okay? Because we all know what we're supposed to do for health. You know, doctors know about health. How many doctors are healthy? Okay.
Right.
So there's a difference between knowing and doing. So this is all habit change. And this is why I love GLP-1s, because they also help us to make better health decisions. People will go, you know what? I don't think I need that extra bite. Okay. I don't think I want that alcohol. So it really helps people to slow things down, process things, and make better healthy decisions. So it's a great drug from that standpoint. The other side of it, which you talked about, is that there is also side effect with this medication. It can cause nausea, it can cause pancreatitis, it can cause all of these other problems, malnutrition, because people are suppressed and they're not eating, they're losing muscle. All of those things are real. But the thing is, medicine, and what I've learned, which I really appreciate now, is like now I've learned how to mitigate those risks. And how do we do it? We go very slow. A lot of people get doses of GLP-1 that's way too fast. They lose the weight, they lose everything. They have toxins floating around because all the fat is where the toxin, and they don't feel good. They feel crappy, and it's not sustainable. Okay, so the goal is going very slow, which I've learned over years, and slow, and then change habit. Okay, you have to change the habit, and I stress that quite a bit. In fact, I have individuals who they come in, have you started exercising? Are we doing the protein? They go, no. I just tell them, like, I don't think this is going to really be helpful for you. And I will tell patients that and move on, because I'm doing them a disservice if they are not putting all the pieces together to make this work for them. First of all, it's expensive. First of all, you're making all this commitment, and we want to maintain it and we want to sustain it. So guidance, working on habits, making sure we prevent side effects, and all of that comes to how healthy you are. When you're healthy, you have better resilience with all these medications. So let's get you healthy first. And that is a function of things you control. And that's the very things that we're talking about.
You talked about something really important, that they get too much too soon, and we have this lipotoxicity to begin with, and now it's just being let into the bloodstream. Yep. That's not talked about a lot, right? It's kind of like take a dose.
But there is some emerging data on this where people will lose a lot of weight and they just feel crappy, and all it is there's all these toxins. In fact, there's some clinicians. This is not well documented, but I know of some doctors who have clinics where they actually try to help people with detoxification when they lose the weight that fast, because they just feel crappy, and it's all these toxins that are coming from the fat tissue, and it's everywhere, and it's affecting the immune system, it's affecting energy production. And that's a bad thing. And then the last thing I want to say about GLP-1s is also it really helps with energy, right? It's all about metabolism. And one thing that, we talk about this, it all comes to, and in my opinion, and I think many also believe that it's all about the mitochondria. It's the energy state of the cell, okay? If the cell has energy, it will always make good decisions. The reason why inflammation is not going away is that immune cell doesn't have enough energy to make that decision. How do we make that efficient? GLP-1s can help. So that's why GLP-1 has all this benefit: heart disease, liver disease, kidney. There's all this benefit that we get because it makes the cells more efficient at making energy, but it has to be done right. And then we also have to optimize the lifestyle things so that we can get to some of those benefits that we're looking for.
And if we stay on the same thread of the GLP-1s creating that cellular energy, we're talking about our ATP cycle, we're talking about mitochondria. My concern is I see a lot of folks, like, they're just not getting in enough protein. They're not getting enough fat. So there's, if we're going to talk about GLP-1s, we're talking about they're not eating. Calorie is just a measurement of energy, and they're not getting in enough. So it's like, I can fit in my dress and I have no energy. And that doesn't make any clinical sense for the long-term goal of optimization of the physiology. So I find like there's this discussion of no one's really talking about, we got to make sure we're eating. So how do we get somebody to eat when they just don't feel like eating, right? So that's always my concern. We do see sometimes constipation come into play.
Yes.
And there's some discussion around GLP-1s and gastroparesis. So I worry about that. So again, it's one of these things where I think it's really wonderful. I mean, and again, we're seeing amazing changes. We're also seeing the flip side of that as well, where we just have to focus on how do we get that person optimized. And I love the fact that if you have them on, so would you put them on a detox protocol while they're going through a GLP-1 just to cover the bases?
So not necessarily, depends on the person. But what I do to kind of mitigate those things, right? Like people appetite is suppressed. Like initially they do, but then they start losing nutrients. You're kind of defeating the whole purpose, right? For the mitochondria to work, ATP, we need all these nutrients to make that efficiently. All these cofactors of minerals and things are there. They need to be there to get the cells to work well. So the solution that I've learned, and then through other clinicians, is going very slow, dropping the dose. If people are totally suppressed, drop it, because these things are things that actually the body is also adapting. The body is always smarter than any of these drugs or peptides that we're doing. Eventually the body kind of overcomes it. So going very slow is a good way to kind of mitigate those huge suppressions. And then the education piece. Even if you're not hungry and you can't eat a whole lot, let's make sure that the food you're going to eat is going to be something that is nutrients dense, something that has enough protein and all of those things. And we have to work and mitigate risk. Constipation, that's the worst thing you can do. And then you absorb all these toxins. So putting people on supplementation that support that hydration. So it becomes really, there's a way to kind of mitigate all of these things. But people need to be educated that this is not a benign drug. And the whole point is we're trying to solve health. We're not trying to solve fat or any of those things. It's all about, making the body more efficient at making energy, and then limiting the risk that comes with all of this, peptides. Specifically, we're talking about GLP-1s, because there's a lot of issues that comes with GLP-1s. People going through surgery, you have to pause it because of gastroparesis. If you have gut issues to begin with, we got to solve it. So I definitely do a lot with the gut stuff. So not specifically detoxification on, phase 1, phase 2, but phase 3. Let's make sure the gut is moving. Let's do the fiber. Let's bring in some berberine. That's even where berberine can be good for gut if people can tolerate it. And then getting people to move and do the other things that helps with all of those processes.
So let's, we talk about low dose, but can you talk about the conversation around microdosing? So there are some people who are like, so there's a difference between microdosing and low dose, right? So can we talk a little bit about microdosing?
Yeah, so microdosing, and I think microdosing per definition, and again, quote unquote definition, is like, looking at the lowest dose, or which is like low dose, and then going like a fourth below that as microdosing. And microdosing means different thing to different people. I mean, that means just like a dose that's below what the FDA has recommended as the lowest dose. And even, and that's a big range, okay? Microdosing GLP-1 is helpful in different contexts, specifically when it even comes to inflammation and pain. We actually know that when people get on GLP-1s, high sensitivity TRP, this is actually in a big study that they did, that actually dropped by 37.8%. So you can really decrease inflammatory markers with very low doses, not the dose to lose weight. So that's a dose that's good for inflammation. And we know that every disease is all influenced by inflammation. So if we can control inflammation in a healthy way, that's a positive for health. And then so there's different ways that we do that. If it's for pain, that's what we do it. If it's for controlling some of the noise, food noise, some people, they get to their weight goal, they still have this food noise where they're always thinking about stuff, and low doses, depending on where they are, whatever dose that works for them, can help manage that. And then there's also people that, they fall off. I mean, because life is also stressful. We all know these things. There is life, we have to perform, we have to produce, and that gets in the way of focusing on the healthy goals. So this is a way for them to be able to kind of like, okay, something else that check me so I don't go overboard. I've done this work and I've gotten here, but now I have this situation, I'm stressed, I'm eating more. Can we bring this in so it helps me to kind of manage it a little bit better? So it's all about what are the individual goals that you're working on when it comes to microdosing, and it can be once a week, maybe twice a week. I have people where we do different things. It's not really like a scientific, well-studied phenomena, but again, the medicine that we do now is really, N of one. We have to try to use wisdom and make the right decision for the right person in front of us.
So, with the GLP-1s, we have, GLP-1, the glucagon-like, we got GIP system and pathway as well. And now, I think what Eli Lilly next year for Red 2 tried, right, will be the glucagon, right? So can you talk a little bit about the 3 different pathways? And Red 2 tried is going to be like, they've been talking about this one's like, it's going to be a pill, it's going to be easy, it's going to be like test, nobody's going to lose any muscle, so no sarcopenia, it's going to be a wonder drug more than the other wonder drugs, right? So can you talk a little bit about those pathways?
Yeah, so that's a great question, and people need to understand it. So GLP-1s are the first generations of medications that actually we use for weight loss, and actually it's been diabetic medication for a while. So GLP-1 And then we have a second generation called GLP-1 GIP combination, or we call them the twinkrin. So these are incretin hormones. GLP-1s are incretin hormones. And those are so the Mounjaro and then the tirzepatide are ones that are actually working on GLP receptors and GIP receptors. And these are all receptors that are everywhere in the body that have different functions, okay? And then the third thing that's coming out is retatrutide. People have different ways of pronouncing it. And that's the trick. It's three, is a GLP-1, GIP, and it also works on glucagon. And the idea is that when we have this triple agonist, it tends to protect the muscle more than how much muscle we lose with just GLP-1 alone, because GLP-1 is just hitting the receptor and it's just slowing things down. You're not taking anything in. So people tend to lose a lot of weight and they also lose muscle. But again, it's actually because they're not eating well, they're not doing the exercise, okay? Because the GLP-1 itself is not what's doing it. It's the effect of the medicine and what else is going on within that environment. Are we doing enough? Are we getting enough protein in? So you can mitigate those things. And then the second generation is that, we talk about those things. And when they do studies, the first generation, when the drug comes out, they do the first generation studies, they do the second generation. And then in the studies, the second generation drug, people lose more weight and there's no side effect, right? But in clinical practice, we see something different. Studies are a little bit different. So there's nuances with all of these things and try to figure out which one is best for people. But what we know is that retatrutide tend to be less. People tend to lose less weight. It works well, but they also don't lose as much muscle. Again, in a study, studies are controlled. So it's not, I think what people need to recognize is that this is not going to be like, the best magical drug. People that are on retatrutide, if they're taking all those things and they're not eating well, they're not exercising, your outcome is not going to be better than somebody who is doing semaglutide and exercising and doing all those things well. So it's all about the environment that you put in any of these drugs in. And, we've talked about it. A drug works in everybody in the right person. A drug doesn't work in everybody in the wrong person. And how do you make a wrong person a right person? Optimizing their physiology. So those are the nuances. And, drug is coming out. Pharmaceutical companies put a lot of money behind these things. And they want to push it and they want to sell it. And they're always finding things. But they're not talking about exercise. They're not balancing your hormones. They're not talking about the side effect that you have to deal with. They're not talking about all these other things because that's not their role. So people need to know that they need to do the work themselves, and then these drugs will then take you far.
Yeah, agreed. So let's talk about the next one that a lot of people are familiar with, 𝗵𝗶𝗃157.
Yes. So 𝗵𝗶𝗃157, everybody who's in the peptide space have heard of it. So it's a peptide that's very good, for musculoskeletal medicine. It helps with tendons, it helps with ligaments, it helps with pain, it helps with inflammation. It's a great peptide. Limitation is kind of one of those things. I mean, when we talk about evidence, there's levels of evidence with all these peptides and how they work. But how we look at this is that, this is something that we look at safety. Is this thing safe? BPC is very safe. It doesn't affect your kidney. It doesn't affect your liver. It helps fill the gut. It has all this pleiotropic benefit. So you have to get it through the right sources. And then, again, doing BPC and making sure that you sleep and doing all of those things. So BPC, I love BPC for pain, healing joint, healing tendons, and controlling inflammation, specifically for the gut. Yeah.
Beautiful. And then the 𝗵𝗶𝗃157 for the gut inflammation, has been good. What about TB500?
Yes, 𝗙𝗂𝗋 β4. So that's a great peptide also for healing. It kind of does the same thing as BPC, but it's more regenerative. It helps the body to regenerate. It gets all this angiogenesis cells to get there, and it modulates inflammation in a healthy way. There's all these things that are happening at the cellular level, but what it does is it's more regenerative. And sometimes when you're doing these peptides, you want to control the inflammation first before you do the regeneration. So one peptide that I like, I don't know if we're going to talk about it, is thymosin alpha-1. So it's thymosin alpha-1 and thymosin beta-4 are like kind of similar. They're all kind of made through the thymus gland. And again, all the things we're talking about, your body makes them, okay? But you lose your thymus gland when you hit 20 years, so I don't know when we lose it. But so it goes down. So thymosin alpha-1 helps to control the inflammation, and then TB400 or thymosin beta-4 comes in and helps with regeneration. So there's also a science and art to using this peptide. You just don't stack things that people do just because somebody talk about it on the podcast. Okay.
Right. And what about 𝗏C? Can you talk about that one?
Yeah, so 𝗏C is a mitochondria peptide, and mitochondria peptides are really amazing. When if I have to pick peptides that I like, anything that modulate metabolism, mitochondria, immune function, those are really, really powerful tools. Okay. because it comes to all about the energy of the cell. If the cell can make energy efficiently, everything works well. So 𝗏C is a mitochondrial peptide. It's also a metabolic peptide. So it's a great one for even people trying to lose weight. You can do low doses of GLP-1s plus 𝗏C. Energy-wise, working out, it has all of these other benefits. So mitochondrial peptide is great. I don't know if you've ever heard of SS31. Have you heard of SS31? Mm-hmm. It's actually a new mitochondrial peptide that's FDA approved. And that's also great for so many things. Energy, you dose it for a little bit. Another mitochondrial peptide is humanin. So yes, all those mitochondrial peptides are excellent for supporting overall health.
And isn't there one that's someone asked me about it, I did not know the answer to it. Is like a copper one?
Yes, 𝗙𝗂𝗃𝗃. 𝗙𝗂𝗃𝗃 is an excellent peptide. It basically is 3 amino acids. And it does so many things in the body. It kind of like modulates about 10,000 genes in the body. So 𝗙𝗂𝗃𝗃 is very, very good for skin, for hair. And in fact, they have a lot of 𝗙𝗂𝗃𝗃 in skin product as a peptide. It's good for inflammation. It's good for oxidative stress. It's good for pain. So it has all this pleiotropic benefit. But the things that it's been shown to really help a lot with is collagen synthesis, skin. So that's also a great peptide. It's very safe to explore for individuals.
Gotcha. And then how do you look at it from like a stacking perspective? So you can talk about the stacking perspective and the delivery process. Like how does this work in the sense of, you can share with everybody, I mean, obviously we know how it works, but can you share with them like, they need to see you, you get the peptide for them, and like when you're looking at stacking them as well.
Yes. So that's, going back to this art and science of doing peptides. If I put a peptide that is supposed to be regenerative in an environment that's very inflamed, it's not going to work as well. So what we want to do is we want to control the inflammation. So for example, somebody comes in, they want to, sometimes they want to like, they've been inflamed chronically. It's not an active issue. This is like a chronic pain condition. Well, can I do thymosin beta-4? I would say, let's control the inflammation first. Let's do BPC. Let's do thymosin alpha-1. Let's even do some pentosin polysulfate before we bring in the thymosin beta-4. So there's a way to stack it in a way that, what are we trying to solve for this person? What is their problem? If that person came in and they've just had the injury a week, 2 weeks ago, 4 weeks ago, I would say, yes, let's put in thymosin beta-4. Let's put in thymosin alpha-1. Let's put in. So it depends on all of those nuances. And then there's, peptides when people are trying to improve skin health, improve hair, and all of those things. There is specific stacking that people will do, the 𝗙𝗂𝗃𝗃, thymosin beta-4, BPC 157. All of that kind of works synergistically to kind of support that. And then on top of it, we can even look at some of those growth hormone peptides, CJC, epimorelin. Those are very great for like deep delta sleep and recovery and other things. So yeah, if somebody's not sleeping and you want to get them to heal, using a peptide that helps them to sleep actually will help that process. So then all the other stuff. So that's kind of how I look at it in terms of stacking for individuals to kind of target the main areas. Sleep, I can't stress that enough. And if we can get sleep better, then the rest of the peptides actually works a lot better too.
Gotcha. And can you explain the delivery process?
Delivery process, peptides can be used orally, either by mouth. Some are by mouth. Those are very limited PCs. So BPC is one of those, KPV, lorazepatide. There's other peptides that are formulated by mouth version. And then we also have sometimes inhalation. So there's things that we can put through the nasal. So C-lung, oxytocin. In fact, oxytocin, people have heard of oxytocin, the love, it's a peptide. C-max, there's specific peptides that we can do intranasally or through the nose. And then there's also peptides that we do subcutaneously. We do an injection. So a lot of them are subcutaneous. Again, going back to the point of trying to bypass the GI tract, so then this can kind of get directly to where it needs to go to. So it depends what we're doing, but those are the 3 forms of getting delivery into the body.
Beautiful. I'm so absolutely intrigued by peptides. I really think when it comes to longevity and just optimization, it's great for the physiology. It is also a lot that keeps coming up is this hair thinning. So maybe one of our female patients will start some testosterone and maybe there'll be some hair thinning. We get thyroid and we get hair thinning.
Yep.
COVID, long COVID, and we get hair thinning, right? So do you feel there are peptides that have you seen in practice where this is helping with regeneration of the hair follicle?
Yeah, so that's a great question. And again, it depends, right? It depends on what's causing the process. So there's peptides that are actually very good for her. So GHK-copper is one, thymosin beta-4. In fact, they can formulate this in a way that you can actually use it as a shampoo that some people have tried. I personally have not had a great experience with it in terms of, people doing it long enough to get benefit, but I also know clinicians who actually use those things. So those are all things that people can, use for hair. So there's peptides specifically to help with hair, but then it becomes, what is driving the hair loss? Is it because we have too much DHT? Is it because we have, some alopecia that's genetic? Is it because we have inflammation? A lot of even hair loss is more inflammation, or the very thing we're talking about, micronutrient deficiency. Right? If you don't get enough micronutrients, all these things need nutrients to be able to make the cells. So collagen, vitamin C, all of these things that works on inflammation, oxidative stress. So there's peptide stacks that can be very good for hair. Again, it becomes an individual thing. In my experience, I've done a few of those and I have not seen a whole deal, but some people do have good response to that.
Yeah, we have our patients, they're taking the hormone replacement therapy, and then they want to do like the hair products and hair supplements, but sometimes I'm concerned about what's in those supplements, because sometimes that can interfere with the medication, it can interfere with the hormone. Definitely, we know too much biotin affects the assays when we're doing blood work now. So that's always, and that goes back to liver, right? So especially when we start getting into these herbal extracts, you can see where you can get that autoimmune hepatitis kind of thing going. So I think it's great. I think again, everything else is just you have to be diligent in what one is taking, for sure.
Absolutely, yes. And there's a lot of interactions with some of these drugs too. So definitely, and then everybody's different. And sometimes I see very weird reactions with people that we don't expect. These peptides are safe, but people will develop issues. The 𝗙𝗂𝗿𝗆𝗆 epimoreline or tesamorelin, the growth hormones peptides can cause swelling, so people can present with carpal tunnel type syndrome. They can have nipple tenderness, swelling in your legs. All of those things have to be considered. And then if you're taking other supplements to kind of mitigate some of these things, they also have the effect. Biotin, all of these things have to be processed. So we have to be careful with all of those things for patient safety.
It becomes a world of chemistry. It's going back to biochem class is what it is.
Yeah, absolutely.
So one thing I want to talk about, which I'm also fascinated that you provide, is the therapeutic plasma exchange. Right?
Yes.
So let's talk about that, because I find this also fascinating.
Yeah, so therapeutic plasma exchange is actually a medical procedure that's been around for more than 50 years. We do them in the hospitals. And it's a way for us to take your blood, take it through a machine, apheresis machine, a machine that separates your blood from the plasma. Okay, so the plasma, for people to understand, your blood is made up of your red blood cells, your white blood cells, and other things, and then the plasma is the liquid portion of that blood. So what we do is we take your blood, take it out, take it through a machine, and it separates the plasma from the red blood cells, and then we return the red blood cells back to you using albumin. Now, why are we taking out your plasma? The plasma is where we carry all these inflammatory cytokines. So your body have immune cells that create inflammation molecules or whatever, cytokines, chemokines, we call them. There's autoantibodies, antibodies when your body gets exposed to, for example, COVID, and it sees the virus or maybe a vaccine or whatever it is, it creates an antibody to kind of, because that thing is foreign, to become aware of it. But sometimes it keep reacting. That antibody start causing your immune cells to think the disease is there. And then your immune system keep fighting it, and you create all these antibodies in the system. That weakens the immune system, that affects your energy, that will translate to fatigue and all of those things. The other thing that we also know is in the plasma is toxins. We have plenty of environmental toxins, and they actually continue to go up. So, forever chemicals, heavy metals, pesticides, all of those things sit in the plasma. So this is a way for us to kind of clean the plasma so that people can have an environment where their cells have a clean environment to reset. So one of the analogies people use, is it's basically an oil change for your body. You go in with your car and we take out the old oil change, we put a new one in. It's basically the same idea. And then it has to be done for the right person. This is not for everybody. There is some indication mostly for autoimmune complaints. So people that have lupus. In fact, in the hospital, we use it for MS, Parkinson, myasthenia gravis, other disease states where people's antibodies are attacking their cells. we go in and take it out. We can also even use it for people who have hypercholesterolemia, because cholesterol can build up. People that have familial history of this cholesterol dysregulation, this is something that they use in the hospital to take all those things out. So inflammatory things, super important. Neurological issues, tons of studies have looked at, a few studies have looked at Alzheimer's disease with TPE, or therapeutic plasma exchange, whereby cleaning that environment, we can improve their function, brain function, all of those things. And then a subset of studies have also looked at longevity, because that's the space I'm in. And in longevity space, they've done the studies where people undergo TPE treatment, and they can actually decrease their biological age by 2.5 years. So there's all these places to use it, but it's a great therapy. And what I like about it is that in medicine, as you know, we are always putting in. We are always putting something into the body. So this is more of a subtraction medicine. Sometimes we don't need to add more supplements. Sometimes we don't need to add more peptide. Sometimes we just have to clean the environment so that the body and the cells can reset itself. And that's a really important concept for people to understand, especially when it comes to immune dysregulation, which drives a lot of disease. So it's great to, and the reason why I got this is, like, I have people who have toxins, they have all of this, and they're not getting better. Even though we're doing detoxification, we're doing all of those things, we are not getting rid of the autoantibodies or other inflammatory stresses. And then the immune system is just stuck in this state where it's always reacting. Let's take out the offending agent, and then the immune system can calm down. So that's TPE. There's more to it, but that's just therapeutic plasma exchange in a nutshell. Hopefully it makes sense.
That makes sense. I now have 47 questions. So
okay.
now,
yeah.
So what about, can you talk about the, what does it look like for a patient that comes in, they're sitting in the chair, we're going to talk about that. We're going to, hook them up. What about the sustainability of it, right? Is this something that you see, like, and I know it's going to be diagnosis dependent, like, and symptom dependent, like, are we doing this once a year? Are we doing it twice a year? How are we looking at it from that perspective? And then there must be a certain timing to it. I mean, we have that when we look at somebody like when we talk about takeaway medicine, they come into the office with like a slew of supplements. And I'm like, well, the first thing we're going to do is like take 90% of that away, right? And let's see where we're at. So where are you at when you look at it from the sustainability and the time? Because if you're giving them a peptide, are you giving them peptide and also doing DPE? I mean, I know we have to do a bunch of things at the same time, but if we're taking something away, but we're putting something in, where's the timing on that?
Yes, so that's a great question. And in TPE, one, it's very pricey, so we want to think about cost effectiveness. And there's classification of, there's the Apheresis Society of America, which I'm a member of. So there's criteria, category 1, category 2, category 3, and 4, different disease states. But basically, the point is, when a person comes in and they have a problem, we have to first of all understand their problem, talk about what disease do you have, what problems are going on. We do a full evaluation to understand toxin burden, because a lot of times, people have all these comorbid conditions. Why are they not healing from, the COVID? The COVID or Lyme disease or whatever it is. It's not just that. They have all these other toxins that's making the system not as effective. So really understanding some labs that looks at where they are becomes a place to start to figure out. And then we also want to track that, because objectively, we want to see, are we actually changing those markers? So we can start with all these inflammatory markers, all these toxins, and then after the procedure, we check it in 2 weeks. From a timing standpoint, when we take out your plasma, the first time we do the procedure, it takes about 68% of the plasma. Okay, so and then your body actually makes plasma. We actually give you albumin, so you kind of replace the fluid, so then you don't feel hypotensive or your blood pressure drops, so everything is steady. And this machine is calibrated in a way that as we're taking out, we're putting back in, so it's always the same. So your body makes plasma within 48 hours to kind of replace whatever is taken out, but then it dilutes, right? So whatever we're taking out, everything else kind of comes back in there, and we have to go back in about 2 weeks' time to take it again. So ideally, when people have autoimmune chronic issue, we tend to recommend 3 therapies as a way to start, because by 3 TPE sessions, we are close to getting to 98% of the plasma exchange. Okay, so the first time will give you about 68, the second time about 80, the next time gives you about 90. So this way we can kind of clean everything. And then most people, depending on what's going on, when you do that, they actually can manage and do well, unless somebody have some cholesterol disease where the genetics is reproducing it, or they go back to an environment where the toxin is still there. That then kind of bring things back in, and then we have to kind of look at what protocols. And then there's different protocols for different neurological issues. Sometimes people have to do 6, 3 times a year, once a year. It depends on the disease state. And the other thing that we stress is that because the TPE is taking out all the bad stuff, it also takes out the good stuff. So when you take a medicine, if you're on a peptide, you're on a hormone, and we do therapeutic plasma exchange, it takes all of that out of your system. So what we do is we're going to do that for somebody, that's not when we're doing peptides, because it's just going to take it out. So what we do is we do the TPE, and then after that, we can bring in the peptides. Even certain medication will tell people to hold off anti-anxiety, antidepressants type of medicines, wait till the end of the day to do it, because otherwise it's going to be in the plasma and we're going to take everything out. So it's kind of finding those places to clean the environment, bring whatever we need to put in, and then try to kind of, in terms of frequency and dosing, it becomes what the disease is and what we're trying to solve.
Fantastic.
Does that make sense?
Yeah, that total sense in my brain. I find it absolutely fascinating. Again, I think it's just not talked about a lot. I mean, we're seeing it in longevity circles, obviously, nowhere near general medicine. If I speak to, some of our collective colleagues, I know they would look their head like this, but they do that to me too when I talk about nutrition. One of the things you did talk about, which I find interesting, is how it affects the lipid profile. So you're saying that TPE can affect the lipid profile, correct?
Yes, absolutely. It can, because people that have this familial hypercholesterolemia, they have all these lipid molecules that are deposited in between their eyes, their fingers, they have all this pain. This is a way to go in there and take it out. And in fact, a lot of studies in Europe, this is something that's covered by insurance. So in Germany, I recently came from a conference on all the world people coming together on who study these things. And there was a presentation on looking at 𝗿𝗂𝗏. This particular lipoprotein that tends to form more clot and is an independent risk factor for cardiovascular disease. That actually goes down with this TPE procedures that they do. The thing is that it does come back, so there's a place for it, but it's actually one of the treatment for people who have very severe version. This is not for people who just have like cholesterol problems from whatever. This is actually the genetic version where their liver is just pumping a whole bunch of lipids into the system.
Yeah, that was my question. If you actually saw LPA come down, I'm assuming would you see ApoB come down? ApoB come down as well?
All of those lipid markers comes down. The toxins come down. Even PFAS, forever chemicals. These are things that we know is really hard to get rid of because they just stay in the cells forever. And they're in their plastic and our cookware and everywhere. I'm sitting here drinking from my plastic. So this is something that helps to kind of remove all of those things. And it's a really great tool that, medicine needs. It's not really available in actually most of the outpatient space. So I'm actually one of the first people to do this in Pennsylvania. And the rationale for doing this is that I am interested in how do we get the cell to make good decisions. It's all about cellular medicine. But if the environment that the cell lives in is not clean, the cell cannot make that very well. So we're using all these signaling molecules. We use peptides. Some people say it works, some people say it doesn't. If the environment is really polluted, it's not going to work. So this is a way to kind of clean that environment. So then all the interventions we do actually kind of translate to having more effectiveness because the cells can now get to take that information and do what it needs to do with.
Beautiful. One of the questions that just popped up here, somebody who's watching us on YouTube asked about, what do you think about treatment for low back arthritis? They're asking if there's any good medicine for it. In our world, we're like, how much arthritis, where is it located, with the extent of it. We need to get you moving either way. That's a big thing. But if we're looking at from a perspective of peptides and arthritis and inflammation, is there one or two or a stack of peptides that you feel would be helpful for somebody with lumbar spine arthritis? Yeah,
so ones that are really great, thymosin alpha-1, BPC 157 is a great one. And I also like this other peptide called pentosin polysulfate. So those are great peptides that are very good for the back, for inflammation. And then again, those things are going to just be the signaling molecule. And then we have to do the biomechanic piece. We understand this very well because we're in musculoskeletal medicine. If we don't strengthen muscles, we don't strengthen things, then this becomes limited. And then the other piece that I also want people to get is, when you have pain and chronic pain, there is also the brain component. So we also have to work on the brain because the brain lends pain also. So there's some of those education that we have to put. So when we put all of that together and you have your peptides, you get good response. Does that help? Was that clear?
We're having some connectivity issues today.
Okay. Are you able to hear me, Michael?
Yep. Are you back?
Yes, I'm back.
All right. Excellent. And we're having some connectivity issues today for whatever. You talk about, you're drinking out of the plastic, cup and all that kind of stuff. We always tell patients just to do the,
I'm losing you there a little bit. Can you hear me?
It's back here a little bit more. There you go.
Yes.
All right. Back. You were just talking about, you're drinking out of your plastic cup. I always tell patients, you know what? We can't be perfect, right? So if we can optimize our physiology, then we should be resilient enough to handle what comes our way, right? That's most important. That's why I think, the therapeutic plasma exchange comes in, the peptides, the lifestyle, all that makes the difference for longer run for sure.
Michael, I love I talk about it a lot, and you know this too. It's all about the resilience. Okay?
Yep.
If we can build that resilience, then even a toxin, because we can give two people will be exposed to the same toxin, one person will become very sick, the other person is fine. Why? The resilience, the physiologic resilience. So that's a very important concept, and we understand this and we do this, and people really need to kind of focus on how do we get you to become more resilient. Because you're right, we can't escape these things. We have stresses, we have all of these things. So how do you build yourself so you become a little bit more bulletproof? The whole idea is not to isolate yourself, but to become more resistant to any of those stresses that are in the environment.
Right. We can never go wrong by getting stronger, period. And
yes.
Physiological strong, right? That's what we want. So that's beautiful. Yep. Listen, I could go another hour. This is so much great information. I really appreciate your time. You know what? Don't be too surprised. I reach out and say we're coming back on again. I apologize for some connectivity issues today, everybody, but there's some great information. If you have questions, please reach out. Dr. Christian, thank you so much for your time. I know you're super busy, so I really appreciate your time today. We're going to end the show. Reach out again if there's any questions. Hang on. I'll be right with you. So everyone, a great weekend.
Thank you so much, Michael, for this experience, and I appreciate the work you do and the collaboration. Thank you so much for this opportunity.
Appreciate him. Thank you for helping with our patients as well. Absolutely do wonderful. So it's great. Appreciate it.